It gives me great pleasure to introduce my friend, Dr. Paul Farmer. I'm going to give you a little bit of background about him, so those of you who aren't familiar with him and his work have a little context for his lecture. Paul is the Colocatronis University professor at Harvard University, and he's the co-founder of an organization called Partners in Health. He serves as the United Nations Deputy Special Envoy to Haiti under President Bill Clinton. And Paul is the subject of a best-selling novel by Tracy Kidder called Mountains Beyond Mountains, which chronicles his work in the Central Plateau of Haiti. Better than Mountains Beyond Mountains, he's the author of several books, including Pathologies of Power, AIDS and Accusations, Uses of Haiti, Partner to the Poor, and most recently, Haiti After the Earthquake. His books tackle subjects like poverty, structural violence, and the plight of the poor. I think what's more telling is than all these accolades is why I think he does all this work. Dr. Farmer is a doctor, a true doctor, in the sense that he sees sick people and he wants to help make them healthy and save their lives. And he wants to do that for populations of people, and he wants to do it for individuals. And that's really what drives him. Because of his work, there are literally millions of people all around the world who are either alive or healthy, free from diseases like tuberculosis, AIDS, cholera, malnutrition, and he comes at this problem because he wants to help people and make them well, and it's really truly extraordinary. So, with that, it gives me great pleasure to welcome my friend Dr. Paul Farmer of Portsmouth Abbey.
Thank you. I was a little bit disturbed, I must say, when the amount of applause I got was significantly less than that given to the twins. To say nothing of the triplets choosing twins. Were my eyes fooling me, my medical eyes, or were those triplets choosing the twins? Where are said triplets? Nice. You can sit down. In fact, sitting down, that was when Mike, where's Mike? There he is. Mike, the head boy, right? How could I tell? When you said, okay, all losers sit down now. You seem to relish saying that, I thought, overmuch. In any case, please don't say that to me. I'm here to talk to you a little bit about our work. But I want to, don't worry, this is not going to be a lecture. I'm going to try and make this a brief discussion of some ideas about transformation. I enjoyed hearing Brother Francis's comments and then linking that to Mike's comments about the games, by the way. I thought it's very interesting, the reflection of the spiritual side and then the aggressive sports side trying to beat everybody up. But I'm going to work through this, I promise, and think it through. I want to talk about transformation and also how students can be involved in work like this, from right here in a place like Portsmouth Abbey. I've been hearing about this place from the blocks. Mary and Genevieve, by the way, are back there. You can wave at them. And Chris, I've been hearing about this wonderful school for some years. In fact, I nurtured hopes that my daughter would come here. Unfortunately, she's at another school in close proximity in Newport. I will name it not, but I'm sorry. Yeah, it's kind of like she went to Slytherin. In any case, I'm hoping to see more of you, and also hoping to integrate some of you into our work. I didn't start doing the work that I'm doing, and Chris laid it out very nicely why I do it. I do it because I'm a doctor, but I actually got interested in all of this work, the worlds of the poor and what we could do to make their lives better. I started this in college, but I wish I'd started in high school or even earlier. And nowadays, I meet people, for example, I teach at Harvard College, and I teach at Harvard Medical School, and I'm now working with people who I met when they were in high school at a place like this. And they maybe came to Harvard or worked with us through other universities. And I'm going to close this set of comments about transformation, talking about what students can do, and open this up for a discussion. Now, I said I'm going to use images but not give a lecture. I find that's helpful because, you know, there's so many things that you guys are studying. I was just in the office, one of the offices, and there was this very wry poster on the wall, and it said something like, "Having trouble learning? Have you considered studying?" I know you all study a lot, so I want to give illustrations. Now, I'm not going to talk much. Oh wait, I can use one of these magic things. I'm not going to talk much about the earthquake in Haiti, but I'd be glad to do that afterwards. I don't find it that easy to talk about. I do sometimes do so, and often to say thank you for all the people who helped us after the earthquake. In Miami, where the Block family lives, there were people literally up all day and all night for weeks on end, helping us to respond in the most pragmatic way imaginable, which is, of course, to take care of people who are injured and try and save lives that way. So I'd be glad to talk about that, but I want to focus, as I said, on other kinds of transformation. First, the organization that I volunteer for is called Partners in Health. Very simple idea, and again, Chris Block laid it out nicely. You can all imagine, I'm sure, even though most of you have never been ill and won't be ill, not seriously ill, but all of you either know, have family members who have been sick and who've died. And anyone can imagine what that would be like, to be sick and alone. And it's a good thing we humans have that capacity for thinking what that might be like. And that's what Partners in Health does, try to take those ideas, that natural empathy and compassion and mercy, and link that to very practical interventions. Let me show you some. We work in a dozen countries. Personally, I've spent most of my time in Haiti, where I've been working for 28 years already. And also in Rwanda, where prior to the earthquake, almost 2 years ago, I was living with my family and working on some very exciting transformational projects. Now, what do I mean about transformation? This is my own personal story. I went to Haiti right after college and before medical school. Like I said, it would have been even better to start earlier in high school. How many of you have ever been to Haiti? Or some of you, go ahead, a couple people, more than a couple. How many people have ever been on a mission trip of any sort to someplace in Africa or Latin America? Hands up, keep all the hands up. How many of you have family members, twins, triplets, or otherwise, who have done work like that? So half of you. And that doesn't surprise me. In the small town of Florida where I grew up, it would have been a very much smaller number back then, but this is something we see a lot. So I went in 1983, when I was 23 years old. I just graduated from college in 1982. I know I must seem ancient to all of you. And then went to a squatter settlement. And now I'm going to ask you guys to participate a little bit with me. Who can tell me what a squatter settlement is? Anybody? Raise your hand if you could give me a good definition for squatter settlement. Help a brother out. Who? I'm going to start calling on faculty soon. Yeah, go ahead. Are you just picking on your friend, or does he have a definition of squatter settlement? Tell me. What's your name? Chris. Go ahead.
Okay, so people who are on your property, someone who's just staying there illegally and using the land and that.
That's fair enough. People who are on your property, losing your land. I think that's actually fair definition. Now, say you're on the other side of the equation. Chris, you sound like what we call in sociological terms a white male landowner. So, I'm just kidding. I appreciate Chris's bravery. How about from the other side? How about the point of view of someone living in poverty? What would you... Same... Give me a complimentary definition. Anybody? Come on. Yeah, go ahead.
It's just a place where a group of people can try to live and have the basic
Yeah.
things they need.
And that isn't to say, so a place where people can live and survive, right? So those are both definitions that describe what a lot of people in the world face today. They don't have land, they don't have shelter, they don't have housing. You know, when I was your age and going to Sunday school, also in the Catholic faith, and people would talk about things like the corporal works of mercy, sometimes I'd almost feel like falling asleep. And I would say, what does that mean? And then the answer would be, you know, give food to the hungry and drink to the thirsty and shelter to the homeless, right? So that's how some of us look at it. These people, it's true, as Chris said, they didn't own that land. But what happened is they've been driven up in those hills. Why would anyone want? It's not a particularly attractive place to squat, right? It's not like you're squatting in Manhattan or in Newport, Rhode Island. It's a very difficult circumstance. And the short story is that they had been forced off their land by a hydroelectric dam. So the valley, if you look in the background, you can see the valley is flooded. Right? And I went there, and I was on my way to Harvard Medical School that year, and I thought, wow, you know, these people really need help. A lot of people are sick, and they're not sick because of any fault of their own, just as they were not squatters through some fault of their own. They lost their land to a development project. So I began working there, and now, 28 years later, I'm still working there, but it doesn't look very much the same, as you might imagine. So what are some of the problems that you see here? Look at the mountains. What's missing from the mountains? Everybody said it. There's no trees. So this is another serious problem in Haiti, and in many other places in the world, is deforestation. And deforestation, what does deforestation lead to? Floods. Who said floods? Faculty? That's not fair. He's already under faculty. I'm kidding. Exactly, floods. And that's one of the things that really shocked a lot of people just before the earthquake in 2008, were in floods in which sometimes entire cities, one entire city, was underwater for weeks and weeks. Flooded the entire city. It's on a floodplain, but it hadn't been protected in centuries past by trees. So one of the transformations that I'm going to show you in the next slide. Oh, a lot of, what do you think? Buildings. What else? Trees. What kind of buildings? Well, I could have chosen pictures of houses. Given that of my own profession, you can guess what I'm going to show you. A hospital. This is the same valley, same hill rather, let's say 23, 24 years later. It's forested, and my friends, the Blocks, have been supporters of this work too, and their family, and know that it really is. So I remember one day, I was in clinic. By then it was a hospital. And one of my colleagues, a young Haitian physician, was complaining. He said that he wanted to cut down the trees because it was too dark and shady in the hospital. Now I'm a pacifist, or I would have punched him out. I'm kidding. I would never punch anyone out. But that's how much things have changed in all those years. So those are transformations. What other kinds of transformations are there in a doctor's life, for example? Most of the time you're a doctor, you don't try and transform villages or towns. People, that's right. So let me introduce you to a couple of patients. So this is a patient, this is a before and after picture. And this is a guy who I met in several years ago. And his name is Joseph, that's his real name. He told me, yeah, here's my pictures and my real name. He was about 26 years old, wasn't sure of his age. He'd been off working in the city, which is called Port-au-Prince. Now, what health problems do you think he has? He has malnutrition. That's right. What else? He was dehydrated. Yeah, he was dehydrated because he couldn't really keep down enough food and water. But that's because he had some other problems. Anybody? What's the leading infectious killer of young adults in the world today? AIDS. Yes, AIDS. What's the number 2? Who? What? Who said that? That's right. tuberculosis. So he has all those problems. Cholera, by the way, we can talk about it a little bit. So he has malnutrition. He's dehydrated. Who said dehydrated? Yeah, he's dehydrated because he can't swallow. He can't swallow because he has an infection in his throat, so he can't take in food or water. And he has AIDS, which is probably the biggest problem, and tuberculosis on top of it. Now, how did he get from, boy, I love these pointers. At Harvard, they've taken the pointers away from me because I keep pointing the laser at the students. Someone will raise their hand, I go, yes, you. And someone finally came to me and said, Dr. Farmer, please don't point the lasers at the students. And then finally, I didn't have them anymore. Does this work? Yeah, I should have known. The word got out. So, how did he get from A to B? What do we do? Just go back to your problem list, as we say in medicine. What was the first diagnosis you made? Now, how do you treat that? Yeah, I think you're all going to win Nobel Prizes in medicine and physiology. Give him food. Okay, what about problem number 2? Make sure he has enough to drink, water. And again, I can't help but think, maybe I'm just doing this because we're in a Benedictine institution, but of those corporal works of mercy. Turns out they're really smart. Feed the hungry, clothe the naked, etc. So what else? What's the other 2 problems he has? And what do you think? Yes, antibiotics is actually a perfectly fine term. Some people would have said antiretroviral therapy. You guys maybe have heard of that. That's the treatment for AIDS, but it's still an antibiotic. And someone would say anti-tuberculosis therapy, treatment for TB, is still antibiotics. So that's right. And that's what we gave him. And then he got better. And I got to say, and back to Chris's tribute to me, if I only saw this one time in my life as a doctor, it would be very gratifying. It'd be reason enough to be a doctor or a nurse or a social worker or someone helping to support this work. Because after all, what is the one thing he couldn't do for those services? Take a guess. Pay for them. So if I hadn't seen this one time in my life, I would be gratified. But I've seen it, as Chris implied, not just hundreds of times or thousands of times, but millions of times. Why? Because I work with a big group of people. And that group of people, as you're going to see, includes students. So that's a personal transformation. And here's another transformation. I'll skip through this. It's a transformation of what we might as well call healthcare infrastructure. And if you are in a beautiful place like Portsmouth Abbey or the other unnamed Newport institution right down the road that I'm going to this afternoon, you know, you see beautiful things all around you. Beautiful auditorium, clean gardens, chapels. In a way, and here's something I did not know as in high school or even college, I'd like to share with you. Understand that you're being socialized for success. I didn't go to a fancy school like Portsmouth Abbey, but I was being socialized for success too, because I was born in the United States. And it was expected of me to do well in school, to study, to go to college, maybe even to med school. That was expected. And that's something I took for granted. And when I stopped taking it for granted and thought more about the world the way it really is, the more I got involved in work like this. And again, these transformations, this is an abandoned building, right? Anybody can see at the top it's an abandoned building. But you have to be able to go into places like that and imagine something different, right? Imagine what it might look like if it were transformed into a hospital. And that process for me has been one subject to continuous improvement and refinement, and I'll give examples. And again, I'm not a builder or an architect, and when you start working with architects and builders and engineers, the end product, in this case a hospital, gets even better. I'll show you some examples. This is another, actually, Mrs. Block, Dr. Block in the back, came and she helped plant this garden, and her sister, the Block's Aunt Lori, helped to hang the paintings in the hospital, because every year we'd say, well, is this good enough for our patients? And the answer was always no. The lab wasn't good enough, the clinical services weren't good enough, the physical infrastructure wasn't good enough. And I would encourage you to keep that kind of thinking in your minds, no matter what you do. You know, is it good enough? Obviously, when you're talking about things like sports or your own performance in school, you're holding yourself, and your teachers and the Benedictines are holding you to a high standard. And you can do that on your own. You don't have to have someone else tell you to do that. And it certainly applies in the kind of work we're doing. Now, this is where we got in Haiti after 20-something years as a collective. Of course, the we here is 95% or more Haitian, right? My co-workers, the doctors and nurses and construction workers and priests and teachers, they're Haitians, right? There are a lot of Americans involved too, and some people from other countries, from Cuba to Ireland. We all work together. That's why it's called Partners in Health. And we've made a lot of progress in Haiti between, at least especially the last 10 years. And there's this term in public health, some of you will know it, called scale up. I mean, it probably comes from business or who knows where the term comes from. It means growing your enterprise. And our enterprise is basically addressing health disparities. And we thought, wow, you know, we've learned a lot in doing this in Haiti. Where should we go next? And if you were to think about, if you were a doctor knowledgeable about infectious disease and poverty, what continent would you rush off to? Yeah, exactly. So that's something we wanted to do for maybe 15 or 20 years. We wanted to do that, but we wanted to do a good job, and that required resources of all sorts. But we did go eventually. We went to Rwanda. This is, who recognizes this guy, one of our big supporters? Yeah, that's Bill Clinton. And in 2002, he came to Haiti and said, let's go to Africa, let's go to Rwanda and work together on healthcare projects. And I dithered a bit and said, well, I don't think we're ready. We have to, you know, make sure and protect our work in Haiti. And what about Peru and Siberia? We were working lots of other places. But finally, in 2004, he pushed us a lot. And we met the people from the government of Rwanda. Now, what happened in Rwanda in 1994, so 10 years earlier? The genocide. And we even felt that we, as Partners in Health, had some experience working not only on poverty, infectious disease, what's called primary care and building infrastructure, but also in difficult, conflict-ridden settings. But here was a place, like others we'd worked in, Haiti, Guatemala, Peru at the end of the Civil War, the former Soviet Union as it collapsed. We worked in those places and still do, and successfully. But here was a place where things were really about to turn around, we thought. That's what the government of Rwanda thought, that's what President Clinton thought, and that's what I thought. So here, the work went forward very quickly. And the blocks have been, again, with me on this journey as well. Genevieve, the youngest block, the one with the blonde hair, the BHB, the blonde-haired block, she spent one of these early summers there with me. But what we did was we made partnerships with the Clinton Foundation, the government of Rwanda, which is to say the Ministry of Health, and our various partners. We also started a Rwandan organization. Anybody here speak in Rwanda? Would I love that? He's saying no. Shy. I don't speak in Rwanda either, and I've been working there a long time, but I can tell you, in Inshuti Mubuzima means, guess what, in Rwanda? Partners in Health. So we started that organization too. And we started with 3 steps so we could make this transformation happen. First of all, training. Now, and this is in Rwanda, but do you think these are Rwandans doing the training? They're not. These are my colleagues from where? Exactly. So we went with our Haitian colleagues, and they, of course, were the most experienced people at this of all. They train people. And in addition to training, what do you have to do? Can you go into a place like Rwanda, where there's no hospital since the genocide, and just train people? Would you do that? Nah, that's not going to work. What else do you have to do? Yeah, what did I hear? You build infrastructure. Now you guys know what that means, right? So you build infrastructure, what else would you do? Let me put it this way. You show up in the middle of an area that's had no doctors or hospital since the war and genocide a decade previously. Do you think people are going to wait and get sick later when you've already built the infrastructure? So what else do you have to do? Help them, exactly. That's exactly the right answer, and the right attitude too. So service, that's helping. This is another guy, his name's John actually, and I can make my medical students laugh because I say, John went from looking like Skeletor to looking like he needs Lipitor. But it's kind of a medical joke. The faculty laughs a little bit. They're all taking Lipitor like I am. So John had which 3 problems again? Malnutrition, TB, AIDS. And he didn't really have that. His AIDS was not advanced. It was TB that was really getting him. So he got put on TB therapy. Same guy, a few months later. And then the infrastructure, as was pointed out. So this is the hospital as abandoned, the hospital after it was fixed up a bit. It says in Shutimo Buzima in the background, which means thank you for listening. Now, how could we do better? Well, this is back to Portsmouth Abbey. I look around outside and I can see that a lot of people care about the grounds, right? And it's almost a marker, I would say, of respect for each other, for God, for learning. It's a marker of dignity, right? I saw when I came in a water fountain that was very, as they say, Zen. And some people have to care about these things, about design. And I actually, the father of 2 of the students here today, a father of 2 of the students here today, who's a good friend of mine from medical school, says he's a gardener, and I said, oh, that's my hobby too. This is what I meant, is you go into an abandoned hospital and fix it up. But imagine, again, if you had a partnership from the beginning, where instead of having doctor amateur gardeners and doctor amateur builders or nurse engineers, you really have the whole team. That's what we're trying to do in Haiti after the earthquake, and that's what we're trying to do here. Now here's our model of what I've described to you, and I'll open it up to discussion. We do community-based care, which means we provide the way to get care for people with chronic diseases is to go out to where they live and make sure they have access to not only the hospitals, but also people living in their villages. Those we call those community health workers. They're connected to health centers. They should be able to walk to them. It's not, because these are not people who have cars or even bicycle paths. So that's the next idea. And then finally they need hospitals. Now that hospital picture, it looks kind of like an architect's rendering, doesn't it? Chris actually studied architecture after he went to college. But this is, let me skip ahead. I'm going to skip through these graphs. I don't think we've already made these points. Let me show you some of them. This is that's a before and after picture. That's not an architect's, and that's not an artist's drawing. That's a real photograph. See, we did build a hospital. There it is. Doesn't that look like a painting? It's a photograph. So this time we brought together the engineers and the architects. Some of them were students from Harvard. Others were professionals. Like there's a famous park in New York called the High Line Park. Anybody ever heard of that or been to it? A couple of you? Several of you? It's an old elevated freight train that has been turned into a public garden. The woman who helped design that, a landscape architect, has been living in Rwanda and working. She did this and is now teaching Rwanda. Now, here's my last slide. And it's really to remind me to talk about students. How did we get this done? I went to Stanford University about a week ago to a conference of young people. Some of them are high school students, most of them college. And they had formed a group called Face AIDS. Anybody ever heard of Face AIDS? Hands up if you've heard of Face AIDS. Well, that's in a way good news, because that means you can see how they use their social media, because I don't know anything about Twittering and Facebooking and things like that. I'm too old to learn. But they did that and formed a movement that went from one school, Stanford, to over 200 schools in the United States, and many in Africa. Now, why would I care about that? I'm really glad that, you know, there are people connected to each other. But they helped us build this hospital. How do you think they did that from their college campuses? Do you think they came over and helped us shape the rocks or lay down the bricks? They raised the money, exactly. And are you one of the twins? No, you just look kind of cool. So they raised the money. How do you think they did that? They did it through Facebook. And they did it on their campuses. And they had dance-a-thons. I was out there a few years ago. I said, what's a dance-a-thon? No, a dance marathon. I have no idea what that is, nor do I wish to know. All I know is, who can guess how much money they raised, these students?
4 million.
Well, that's a great guess, because $4 million is how much it costs to build the hospital. But these students raised over $2.5 million of that at this count. Not just for the hospital, but for work that we're doing in Rwanda, Partners in Health. So to me that says, and these are just some images of some of the students, to me that says that there is a big role in not just fundraising, consciousness raising. If I, in a crowd like that, I just spoke to them, as I said, they could tell you all about the root causes of these epidemic diseases, how poverty and hunger are sustained over time or replicated or changed. And so part of what they do is to teach each other. Well, that's my lecture on transformations, and I'd like to stop here and open this up to discussion. And again, I especially want to thank my friends, the Blocks. I look forward to talking to the print and radio journalists of Portsmouth Abbey shortly, and to fielding any questions you might have. Thank you very much for having me. I'm going to repeat it so that it's on tape. I've spoken a lot, or your exact words were, you talk a lot. I've spoken a lot about healthcare disparities in poor areas and also in disaster-stricken areas. With the growing disparities that are in this country, how could some of these models be applied to problems facing us here? Is that a fair summary? Well, that's a terrific question. And let me just say two things. One is that for those of us using the term global health, we're actually meaning it as something different from international health. Because as we'd say, you know, Boston's on the globe too, or the Navajo Nation, or Newport, Rhode Island. So global is meant to think globally. And let me just give one example, a pragmatic example. And if you're going to pursue this, maybe something we can talk about later on today as well. Community health workers. Now, I didn't spend much time on either the earthquake or on this model, but it relies very heavily on community health workers. Of the 15,000 people who work for Partners in Health, more than half of them are community health workers, and the great majority of them have never had a paying job before, outside of maybe the agricultural sector. So the community health workers, we've concluded, offer the highest standard of care for chronic disease. And if you look at what's facing the poor of the United States and the non-poor alike, it's really chronic disease. Major mental illness, obesity, diabetes, hypertension, etc. So what we've done is take that model from Haiti and move it into the shadows of the Harvard teaching hospitals in Boston, community health workers. It's not been easy to move forward, but we have made some progress because what we do is improve the clinical care. As I said, it's the highest standard of care. It also reduces the amount of time that people who have chronic problems go to emergency rooms. So that's just one of many reverse innovations, is a business term. I don't know if I would call it that or not, but that's an example. So we're very committed, and maybe it may be that your question is so on point that this will be the key to also sustaining our work elsewhere, is to helping to crack the code and do a better job delivering services here in the face of rising disparities. Great question. What's your name? Courtney asked that a lot of people who suffer from chronic disease also suffer from mental suffering, but also mental illness. And does Partners in Health address that as well? The answer is not as well as we should, but we now already have many hundreds of those 15,000 co-workers are in mental health. We don't have a lot of psychiatrists. We have 2 psychiatrists who we call our Mario Pagenel Fellows. Mario Pagenel was a protege of mine who was killed in the earthquake, and we named this scholarship after him. And they're both Harvard psychiatrists working, one in Haiti, one in Rwanda, but they're working with nurses, psychologists, social workers, and community health workers, focusing on all kinds of trauma, not the trauma that we were focusing on right after the earthquake, but speaking about Haiti, but on the less visible trauma, and also focusing on improving mental health. And it's a big challenge for us, and I think we have a long way to go, but I would hope that that is permanently on the agenda of Partners in Health, and that we're going to put it on the agenda of all of those looking at non-communicable diseases. And there's more interest now in global health than there was just a few years ago. Great question. Yes?
You talked about the Rwandan genocide a decade ago. How does it affect your work there?
Great question. What's your name? Ellie wants to know how the genocide affects our work there. Well, it's kind of a constant backdrop, if you can. By the way, speaking to the triplets, where are the triplets, my buddies, the triplets? There they are. You know, I was up in this beautiful hospital. It wasn't done yet, so I was actually in the dumpy little clinic right nearby. And I'm going to get back to the genocide because it's relevant. And I'm looking at the triplets for a reason. And so there had never been any doctors here, much less a hospital. Since in 2004, there were none. I'm also always trying to find stories that I hadn't told the blocks before, so they don't get tired of my stories. And now, here we were, the hospital wasn't built, but we had probably 6 or 7 doctors, including Haitians, a Congolese doctor, and then some Rwandans, a couple of Rwandans, and many nurses. And we had introduced ultrasound. Ultrasound's a great tool, right? It's a good tool for cardiology, for obstetrics. And so we knew that we were having triplets. Not me personally, but this woman was coming in to deliver triplets. She had ultrasounds the day before. So I wasn't on call, but I was around the next day. And the story that they told was that there's quite a few people, almost a crowd, because triplets are unusual. Not saying you guys are unusual, I'm sure you're unusual, but I just mean statistically you're unusual. You must be tired of hearing this. Where are you again? Raise your hands, triplets. What are your names, triplets?
Ian, Trevor, Sean.
So everybody's really excited about the arrival of the triplets, and they're going, number one. And remember, this is without a hospital, a real hospital. This wasn't built. Number one, out comes number one, a girl. Number two, out comes number two, a girl. Number three, a girl. And then a drum roll, silence. There's another one in there. Quadruplets. 4 girls. All of them alive and well to this day. Now, why I'm telling you that story about the genocide? Because I told you now, you're in a hospital in the north, right on the edge of Uganda, the scene of a lot of terror, right? And also the war went on longer there, 2 years longer in the north, with incursions from across the Congolese border. And I think the way it affects our work is here we are now. I told you there was a Congolese doctor delivering the 4. By the way, guess what the wearied mother called her daughters in Rwanda? 1, 2, 3, and 4. Ask Mrs. Block. So, the way it's backdrop, right? You know that word, backdrop. We don't talk about the genocide. We see it every day. Like in this group there, one was from the Congo, and his family was displaced by the genocide. 2 from Rwanda. Again, many of them lost their family. The Haitians, they were there like I was to help repair things. And instead of talking about it, certainly as non-Rwandans, what we do mainly is focus on high quality services for people whose lives were very badly damaged by the genocide, and also to attend to mental health questions, which have been more pronounced there in northern Rwanda, the hometown of 1, 2, 3, and 4, than in other parts of the country where there are also huge problems. It was estimated by my coworkers that a quarter of all the visits into the ambulatory center, which was the other place where 1, 2, 3, and 4 were born, a quarter of all the visits are mental health related. So that's how we do, that's how it affects our work, I think, most. It's a great question, too. There's someone over, yes? Questions, how can students be involved? Well, I was just at Notre Dame. It was actually just my birthday, and I went to give some talks with a theologian who's a friend of mine from Peru, a great man. I think he's kind of a holy man, frankly. He's 83 now. And his English is not perfect. We're giving a talk in front of 1,000 students, and he said, well, I'm sorry for my English. It's really not very good. But if you're just patient, I make the same mistakes over and over again. And he kind of does. But one of the things he said in response to that question, he said, there are 1,000 manners. You know, and he was thinking, mil manera. And there are 1,000 manners. 1,000 manners that people can be involved. I think the three that you mentioned, I mentioned fundraising, but I also mentioned consciousness raising, awareness raising. If you live in a world where people are unaware of the problems of, say, unfair trade, right, or how hunger is sustained, or global warming, or the environmental crisis that is facing us already, or water insecurity. If we live in a world where people of privilege like you and me, if we don't understand that, then how can we do a better job confronting these problems? They're surely your generation's problems to shoulder, right? There's no way around all those problems I just listed. The water problem, food security. So you're going to have to figure them out. So that's why I think consciousness, what you call awareness raising, is a big part of it. I also think that people like me do need support, right? We need to know our friends care about our work and understand it. I have the easiest job of my coworkers, but a lot of them, the young doctors and nurses, are, they're sometimes. Imagine what it was like living up there before we had the hospital. It's actually emotionally difficult as well. The reason I wasn't here last night is I was at a conference on cancer disparities in the low and middle income countries. And I looked around the room, there was a big crowd, I was closing it up. I didn't get here until midnight last night. And I was finishing up, and I looked around, and I saw my students who are now doctors. I saw a pediatrician, 2 trainees in oncology, and another who's a cardiologist. All my students, all my former students. And I thought, of all the things that they've been through and seen that has been hard on them. And, I think that's another thing that we need for our friends here in places like Portsmouth Abbey to do is, maybe Brother Francis would say you need us to pray for you. That's true too. When he talked about the church militant, which may sound like an old school term, militant, militar in Spanish is to act, right? And it is difficult work. So that's just 3 more parts of 1,000 manners I think students can help. But above all, be aware and engage. Don't forget, poverty is, as has been noted, it's not a faraway phenomenon. There's poverty in Rhode Island. There's poverty in Boston. There's social justice needs in almost any community you can imagine. And then this area was at one time a retreat for wealthy people, right? The houses of the rich. Retreats are okay, but we live in one world, not 3, right? First, second, third world. It's really just one world. And so I think that also reminds us how important it is for everybody to understand the planet that we're living on and to take good care of it. It's a great question. Yeah, how has work on a global or policy scale, like with the World Health Organization, affected the care for individual patients? I think, again, we're back to this question of failures of imagination. Like, I'm not, I mean, if someone says to me, did you imagine, Paul, a hospital that looked like this in the middle of on the edge of the Ugandan border, in the middle of a place with no electricity? You can tell the answer was yes, I did imagine that. It's exactly what I imagined. In fact, when I go into that hospital, what strikes me are the shortcomings, right? Because I'm still seeing issues. Nowadays, I often keep my mouth shut instead of saying, "Why isn't this done correctly?" or "Why isn't this tile laid?" It's not a good thing for me to do that, so I don't do it so much anymore. But I can imagine that. So failures of imagination are most frequent at the policy level, I would say. And I'll give you an example, and then I don't know how many. I mean, I'm thrilled to be here, but you have to tell me one more after this. Okay. So cholera. I didn't talk about cholera, but cholera has gone in 1 year and 375 days since the first case in Haiti. It has become the largest epidemic in the world. Now, how could that happen under the noses of all this humanitarian machinery? That's what a journalist asked me just a week ago when I was in California on the phone. And he said, "Are you telling me that this cholera epidemic became the largest epidemic in the world under your very noses? How?" And what I want to say, and I will say to you, is it's a failure of imagination. Because our policy efforts at the international level didn't keep up with the microbe that's caused by a bacterium, right? Example, where's the cholera vaccine in Haiti? We still don't have the vaccine. And this is a lesson that we learned, and Mrs. Block, Dr. Block was with me in Haiti on this, is that no one's going to come and rescue us, the experts, right? And for me to just complain about cholera and say, well, we can treat the person in front of us, and it was true. We went from a situation where 10% of people with cholera were dying to almost zero. That is, we took good care of them. But the real trick is to make them never get sick in the first place. That includes clean water, sanitation and water. Now, in the short term, we need the vaccine. And in the end, Partners in Health ended up buying all the vaccine stock left in the world. And we shouldn't have had to do that, I feel. And we're still looking around for money to pay for it, which again, I think is absurd. And the way we're going to change that in the future is to work more at the policy level. So when you do work at the policy level with bodies like the one you mentioned, the World Health Organization, the American Health Organization, the United Nations, the idea is you change the rules of the game, and that can help you pull other levers, to use a metaphor, so you can help more people. It's an important part of the work. So those of you interested in policy, public policy, or any kind of policy, forward-thinking, humane, progressive policy, I would encourage you to do that. One last question, yes, and then I'll stick around after.
What would you say to people who would like to do what you do currently?
What would I say? What's your name?
Patrick.
What would I say to people who would like to do what I'd like to do? I would caution them a little bit and say, the trick in this work is to find out what you'd like to do. And this work I would construe very broadly. For example, you just met Chris Block, who went to school here, who's a businessman, has a small business. He has training in business and in design. And I want, my friends who support my work to do the kind of things they want to do and support this work in the best way they can. For some people, it may be going to medical school like I did. Or I even did another degree at the same time as medicine in anthropology. I like doing that, right? Some people may be theologians. Some people may be Benedictine friars training kids. So I think, in my view, it's very expansive, like Father Gustavus, the 1,000 Manners approach. If someone really wants to do what I am doing, which is different now than it was 25 years ago, I would try to teach them and be a mentor to that person. In fact, I'm lucky enough as a teacher at Harvard Medical School to have a lot of very talented students who want to do global health. That wasn't the case when I was a student 25 years ago. Now, a lot of the students are very interested in this work, and I'm very excited about that. But I want to close by reminding everyone here, especially the students, that there's not only 1,000 ways to get involved, but also that this is your job too. It doesn't matter what you do; it's still your planet, and this is a Catholic school. So I'll remind you that Catholic really means universal, right? It means everybody. That's what the word means. So I do believe, Patrick, that if you want to do this kind of work in medicine, I'll be glad to be of help to you in any way I can as a teacher. But for those who have no interest in doing medical work, direct medical work, it's still your responsibility to help think through these big questions that I've mentioned. It has been a great privilege to be here, and I will stick around up here for those of you who want to talk more. Thank you all very much.